First, I would like to learn about the background and current application of thermotherapy at Yokohama City University. It's my pleasure. First, I would like to learn about the background and current application of thermotherapy at Yokohama City University. Certainly. Yokohama City University has undertaken a varied approach with the cooperation and according to the requirements of each faculty. We have been applying combined thermotherapy and radiotherapy for the treatment of various types of tumors, such as hepatic cancer, gallbladder cancer, and pancreatic cancer in the abdominal region, cystic cancer and rectal cancer in the pelvic region, and recurrence of these cancers following surgery. The equipment we are using for treatment is the sahmaraniRF-8, which treats the tumors of the patients with a radio frequency of 8 megahertz. Generally speaking, the patients undergo both radiotherapy and thermotherapy once or twice a week. In one treatment, 4 gray of radiation is applied to the tumor. Then, thermotherapy is continued for 40 to 50 minutes. Radiotherapy is performed immediately before thermotherapy. A total of 8 to 10 sessions of thermotherapy are scheduled.
放射線は1回に4グレイ、照射し、温熱療法は40分から50分行うことにします。そして放射線療法は温熱療法の直前に、行います。でトータル温熱療法は8回から10回を行うことを目的にしております。
Yes, I have seen how this therapy was performed for a patient with a tumor on the left side of the mouth. This patient is a 93-year-old woman who for the past several years has had a large ameloblastoma on her lower left jaw. But this year, the area protruding into the oral cavity became cancerous. Because of this, a treatment of combined thermotherapy and radiotherapy was prescribed. As you can see from the results of the CAT scan, a large tumor with a radius of about 5 centimeters was protruding from the lower jaw. This view of the area protruding into the oral cavity has been enhanced by CAT. This is the cancerated site. To date, a total of 45 gray of radiation has been applied in radiotherapy, and thermotherapy has been applied 4 times. The current treatment is the 5th. Previously, the tumor protruded into the oral cavity with pain and bleeding, and she had difficulty in eating. Presently, however, the tumor surface has become smooth and bleeding has stopped. How do you measure the temperature of the affected region? That is a very important consideration, I think. In this patient, we insert a thermal sensor between the tumors protruding into the oral cavity. Then, to determine whether the skin is becoming excessively hot, another thermal sensor is applied to the skin. For how long is heat applied and how high is the target temperature? When the combination treatment with radiotherapy is used, the target temperature is 42.5 to 43 degrees Celsius. However, if chemotherapy is used to accompany the treatment instead of radiotherapy, the target temperature may be 41.5 to 42.5 degrees Celsius, depending on the chemotherapeutic formula used and the organ to be treated. Are there cases where the temperature cannot be easily elevated? Do you have any special techniques for such situations? That is a rather difficult issue. If sufficient RF power is applied to the affected region, the temperature of the region will naturally rise. But when such power levels are applied, there may be side effects, such as pain and burning due to, for example, the hardening of subcutaneous fat. Thus, it is essential that we apply sufficient power yet not cause side effects. To ensure the intended effect, the setup, that is, the process of applying the electrodes on the patient, is very important. In other words, we have to know where excessive current is likely to flow or where a patient is likely to feel pain and prevent these problems. For that reason, we employ a method called pre-cooling. In pre-cooling, the lesion surface is cooled beforehand, and then an overlay bolus is used. Specifically, burning or pain caused by subcutaneous bleeding is prevented by applying a plastic bag of cold water. Moreover, we apply the jelly used in ultrasonography to the sites where such side effects are likely to occur. If sufficient power can be introduced with such techniques, the temperature of the lesion will naturally rise.
こういうものを防止するわけです。で、さらに、私どものところでは超音波検査に使うジェリーを使ってこれをあらかじめ、そういう副作用を起こしそうなところへ塗布しておくことにしております。これらのことによって十分なパワーを投与できればまず温度というものは上がってくるわけですね。
Are there any other points to be considered during this treatment? There are several other things we must consider. First, when thermal therapy is applied to the abdomen or large intestine, the digestive tract should be completely void of food. Also, when thermal therapy is performed, the patient is likely to sweat a great deal. So, changes in body fluid are likely to result. Thus, body fluid should be sufficiently replenished following treatment to maintain the patient's physical strength. The large volume of sweat also makes it essential to maintain body hygiene. This therapy takes a very long time, both for the pre-treatment stage and for the treatment itself. In addition, because the patient has to remain prone in the equipment for a long time, he or she suffers a great deal of mental stress. To alleviate this stress, the doctors, nurses, and technicians must chat with the patient to ensure clear communication and to increase the patient's understanding of the therapy. I think it is important that treatment proceed in an atmosphere of calm cooperation.
患者さんとのコミュニケーションを十分取りながら患者さんの治療に対する理解を深めていただいてそしてお互いに協力して治療していくこういう、お互いに努力するというコミュニケーションを十分に取ることが必要だと思います。
実は
I interviewed this patient after her treatment. Did you experience any difficulty during the thermal therapy? No. Do you feel excessively hot? No, not too hot. Have you experienced any pain from this thermal therapy? No, none at all. Do you think your symptoms have been alleviated by this therapy? I haven't had any problems with this therapy, and I think there has been some improvement. Yes. Very good. Thank you very much. You're welcome. It seems that the patient I spoke with experienced considerable improvement in subjective symptoms. Has there been similar improvement in the subjective symptoms of other patients? Yes, there have been many cases of improvement. For example, we treated several patients suffering from gastric cancers who could not eat because of disorders in the digestive tract. More than 60% of these patients experienced improvement in subjective symptoms following treatment. Could you tell us about your experiences with other patients? Certainly. One patient visited our hospital because of severe jaundice and decreased body weight. Remarkable stricture of the choledochus was observed in an X-ray examination, and the patient was diagnosed as having progressive pancreatic cancer, for which surgery is impossible. In this case, we used thermal chemotherapy. The pancreas reverted to a normal state following treatment, a result that was confirmed in the CAT scan. Now, 1 year following treatment, the patient is doing very well. Have the results of the treatment demonstrated any advantage from the combination of radiotherapy or chemotherapy with thermal therapy as compared with conventional radiotherapy or chemotherapy alone? Yes, there is a definite improvement over treatments employing only one therapy. First, we used the combination of thermotherapy and radiotherapy on patients with rectal cancer. All 8 cases showed some improvement. Thus, the treatment was effective, or could be described as partial response for all patients. Next, We used a combined treatment with thermal therapy and chemotherapy, mainly for patients with gastric cancer and pancreatic cancer. The rate of effectiveness of the complete and partial response of the treatment was 29% in gastric cancer cases and 35% in pancreatic cancer cases. Thank you very much, Dr. Kakehi. You're very welcome.